The parietal lobe of the cerebrum consists of the primary somatosensory cortex, the somatosensory association cortex, and the posterior association area. The boundaries of the parietal lobe are formed by the central sulcus, the parieto-occipital sulcus, and the same sylvian fissure or the lateral sulcus. So the brief function of the primary somatosensory cortex is involved in the conscious awareness of somatic senses, which are the senses which are coming from different parts of the body and the viscera. Somatosensory association cortex is responsible for analyzing the recognition, memory storage of somatic sensations. That is, the somatic sensations which are coming from different parts of the body into the primary somatosensory cortex are then passed on to the somatosensory association cortex for their association and analyzation. The third is the posterior association area, which contains which is located in we can say it is located in all of the parietal lobe also, occipital lobe also, and some of its part is located in the temporal lobe also. The parietal part is involved in somatic senses, the occipital part is involved in visual sensations, and the temporal part is involved in auditory sensations, right? All these together are included in spatial coordination, so together we give them a name of spatial coordination, right? So let us see further each of these areas in detail. So first let us talk about the primary somatosensory cortex. This is the general structure of the primary somatosensory cortex. We have dorsal column, medial lemniscus, and the spinal thalamic tract. All right. So the sensory informations which are coming from the dorsal column, medial lemniscus, that is the DCML, are coming from the this side, and from the spinal thalamic tract are coming from this side. As we can see that these sensory informations of fine touch, discriminative touch, the proprioception and vibration which are coming from the DCML go towards the opposite side, that is on the left side, and the informations which are coming from the STT, that is the pain and temperature, the crude touch and pressure, go towards the opposite side, that is on the right side. So these intermingle, they are countering each other, and they move towards the opposite sides through the spinal cord. So this is the basic structure of the primary somatosensory cortex. What we are trying to say is that they are basically passing the information, sensory information, from different parts of the body to the central nervous system. The primary somatosensory cortex also provides motor information to the corticospinal tract and the corticobulbar tract, which we already saw in the last video. 40% contribution, it has 40% contribution to this. So besides acting as the sensory part, it also contributes to the providing motor information to the CST and the CBT, which was the main function of the frontal lobe of the brain. All right, let us look at the somatotopy. This is the basic structure of the primary somatosensory area. This we have already seen in the last video also, that the somatotopy involves the homunculus. In the earlier video we have seen the motor homunculus. This is the sensory homunculus, which is the same similar kind of arrangement. That is, this area receives the sensory information from the leg, this area receives the sensory information from the hand, and this from the face, and this from the tongue. And the structure we are seeing is the coronal section of the primary somatosensory cortex. Now let us see the arteries. This is the internal jugular artery. The artery which is supplying in this part is called the anterior cerebral artery, and the artery which is supplying in this part is called the middle cerebral artery. All right. So now let us look at the same thing which we saw in the last video. Lesions in the anterior cerebral artery can cause a sensory loss in lower extremity, and the lesion in the middle cerebral artery causes the sensory loss in the upper extremity. This is the same thing which we have seen in the last lecture. Now let us talk about the second area called the somatosensory association cortex. It receives sensory impulses from the primary somatosensory cortex, and the sensations it first analyzes. It analyzes the size, texture, weight, and position of the object. For example, if a person has closed his eyes and he is given an object in his hand and he is trying to identify, so first he will analyze the size, texture, weight, position through the somatic senses, stores in memory, identifies the pattern, which ultimately leads to the recognition. Now let us talk about the lesions here. These are different kinds of clinical conditions. For example, if we are giving an object to a person, we are keeping an object in his hands and we are asking him to close his eyes, and if he or she cannot identify what the object is. For example, if you are given a marker and you can and if you are asked to close your eyes, then you can easily identify that it is a marker in your hand or a pen in your hand. But these kind of people with this clinical condition cannot identify this, and this condition is called asterognosis. All right. This you have to remember. Now the second part is hand. If we take the hand of a patient and try to draw a number with our finger, that is giving him a sensory information, and we are drawing a number. Suppose we are drawing a number 7 on his hand or a 6 on his hand, and if he or she is not able to identify the number, then it is called agraphesthesia. All right, these are clinical conditions which you have to remember. Now the next clinical condition is when we are moving their fingers up and down. For example, if we take the hand of the patient and we are moving his fingers up and down rapidly, and suddenly we stop and ask the position if their finger is, whether it is on the upside or the downside. If they can't recognize, then it is called astatognosis. Alright, and the last is the inability to distinguish basic weight differences. For example, if you put a dumbbell in one hand and a marker in one hand, he or she will not be able to tell the differences, that which hand bears more weight. So this condition is called abarognosis. Now let us move to the posterior association area of the brain. This is the multimodal association area, as we have already seen that it is located on all three of the parietal lobe, the temporal lobe and the frontal lobe. It has parts on each of the lobe. It receives sensory information from the primary sensory cortex, association cortex, and it has information in three parts: visual part, auditory part, somatic sensory part. We have already seen this. That's why it is called the multimodal association area. The posterior association area also coordinates with the motor cortex. So it coordinates with the motor cortex. This we have seen in the last lecture. So that's all about